Do puppies need different diet than adults? How should a dog be fed daily?
Some people fast their dogs one day a week. We want our dog's blood sugar to be, really healthy blood sugar for us and for them is probably 60 to 80.
Are you familiar with beagles specifically, and are there any beagle-related issues that we beagle owners need to concern about? How about spaying and neutering? Hello dog lover, my name is Saro. I'm a dog trainer, also coach dog owners, and in this video I have a special guest who you're gonna love. I have with me Dr. Judy Morgan, has over 36 years experience as a integrative veterinarian, acupuncturist, a chiropractor, food therapist, author, and speaker. Her goal is to change the lives of over 10 million pets by educating and empowering pet owners worldwide in the use of natural healing, minimizing the use of chemicals, vaccination, and poor quality processed food. Dr. Judy Morgan, welcome to the show. Thank you for being here.
Thank you so much for the invitation.
Do puppies need different diet than adults?
They do, in that their mineral requirements are a little different. And people ask me all the time, my most famous recipe is pup loaf. And pup loaf has like 20 ingredients in it because it's balanced with using all whole foods and not having to add supplements to it to get your vitamin D and everything up to snuff. So people ask me all the time, well, I'm getting a new puppy and I want to put him on homemade food. I don't want to use commercial diets, commercial kibble. I'm starting out on a new foot with this dog. I say, that's great. Could you not use the pup loaf until he's like, depending on the size of the dog, 6, 8, 10 months old? Mm-hmm. I don't formulate for puppies, and I don't really recommend that people, unless you are really, really educated in nutrition, I don't recommend that people formulate their own puppy diets because that's the growth phase. And if we get it wrong, their bones are screwed up. You do not want to set that dog up for failure for the rest of his life because you didn't have your diet perfect. So I have a few companies that are pre-made raw formulas that are formulated to that life stage. So if you're looking at doing something different than what you've done in the past, when you look on a website or look on a bag or container at the pet store, it either needs to say for all life stages or for puppies in order for it to, if it just says for adults, that's not what you want to be feeding your puppies. It's really important that the puppies get off to a good start.
Right. And how should a dog be fed daily?
Ask 20 people, you get 20 different answers. Ours eat like clockwork at 7 a.m. and 6 p.m. Twice a day. My mom's dog eats 3 times a day, the one that's almost 17. And that dog, her clock says 8 a.m., 12:30, and 5. And the dog doesn't move around much, but she sleeps back in the bedroom and then magically appears in the kitchen. And I can tell you what time it is based on when that dog walks out into the room. That's just my mom. The dog was having some problems. She was losing some weight, so she went to 3 times a day. Right. And the dog is like, I'm sticking with that. Thanks, I like it. Other people feed their dogs once a day. Some people fast their dogs one day a week. There's no right or wrong answer to that. I know that if I ate once a day, I'd be so hangry my wood personality would come out and it wouldn't be pretty. And I look at my dogs the same way, and I'm like, well, I mean, at least twice a day, you guys can too.
The reason I was asking this question was to get the understanding. Do dogs, does eating food, whatever it is, does affect their health if they're eating too often or too, once in a while, or they're eating too often? Well,
there's new research on that, and there's, again, different thought processes on that. For instance, we want our dog's blood sugar to be, really healthy blood sugar for us and for them is probably 60 to 80. If you test raw-fed dogs who are not getting carbohydrates, even after they're fed, they're going to be in that range. For dogs that are kibble-fed, it's going to be 120, 130. It's kind of like us eating processed food and carbs, blood sugar spikes. It just, that's the name of the game. Having a lower blood sugar and having a lean body weight is huge for health and longevity, huge. So keeping your dogs on a body condition score of 1 to 9, keeping them at 4, so 4.5 would be right in the middle. Keeping them at 4 is much healthier than at 5, 6, 7. Most people, especially in America, most dogs are running around at a 7. Well, he looks good to me. You know, you haven't seen his waist in forever, but you know. So, and the whole idea with fasting for a day or only feeding once a day is that you allow that blood sugar to really drop. And so they start utilizing ketones instead of glucose as their energy source. And being in ketosis, so a lot of people are now doing keto diets for people. We have pretty good evidence that keto diets are very much anti-cancer. They're also anti-diabetic, anti-inflammatory, anti-seizure. The big thing with keto diets is they have to be fed raw because they are high-fat diets. They are probably 70% fat because you want to be utilizing ketones and not glucose. So you want to get as close to 0 net carbs as possible. So you're only using things like broccoli, cauliflower, Brussels sprouts, veggies that really are a net 0. Along with moderate protein and then very high fat. And the reason it has to be fed as a raw diet is the same reason of the fats oxidizing in the dry kibble. When you cook fats, they oxidize and you will get pancreatitis with a 70% fat diet that's cooked. So when you have a raw 70% fat diet, fats aren't oxidized and you won't get pancreatitis.
Interesting. How do you see exercise for dogs being a factor in their health? Do they need a lot of exercise? I know it depends on their lifestyle and all that, but does exercise come into picture of improving or affecting their health and lifestyle?
Absolutely. Like I said, we're pretty sedentary at our house, but we try to get the dogs are going in and out the door all the time to the fenced yard, but we try to get them out for at least one long walk a day. And we have one who can't do that. So she goes in a stroller or a wagon because it's still very important for her to get outside, go on a smell tour of the neighborhood and have that mental and physical stimulation of the sun and the wind and the elements and getting out of her environment. Like I said before, if you have one of those high drive breeds, they absolutely, you're going to have so many health issues. And as our dogs age, it's very easy for us to say, oh, he's getting old, he's not moving around so much anymore, I'm not going to do that. No, you've got to keep them moving. Anybody who has arthritis knows when you get up in the morning, you're very stiff, everything hurts, but once you get moving a little bit, it's like, okay, I lubricated my joints, I warmed things up, I feel a little better. So we want to keep these old dogs moving as much as possible because when you stop, it goes downhill very, very quickly, very quickly. Dogs with degenerative myelopathy, the way to keep those dogs going is you keep them moving, and you keep them moving on rough surfaces like grass and gravel and things that are very tactile. It's important for mental stimulation. It's important for health. It's important for getting the chi flowing. There's a lot of reasons for keeping these guys moving. And from a holistic standpoint, I can feed all the best food in the world, but if these dogs don't move at all, which, believe me, mine are couch potatoes, and they would be just as happy to never move. But if they don't get that, we know that things degrade more rapidly. So it's very important.
Great. Yes. I have many Beagle viewers. I'm a Beagle lover and owner myself, and lots of Beagle owners watch my channel. So I'm sure they're going to wonder and want me to ask this question. Are you familiar with Beagles specifically, and are there any Beagle related issues that we Beagle owners need to concern about?
It's kind of funny. My office manager, we share an office that's about 4 by 6, so we're like this. Right. She does Beagle rescue, and we've worked together for 25 years, and she always has 3 to 6 Beagles in her house. So we do a lot of Beagles. The things that I see are the biggest problem with Beagles, we see a lot of disc disease, so a lot of back problems, neck problems. We see a lot of transitional cell carcinoma in the bladder of Beagles. Very important that you are not using chemicals on your lawns, because we know that that is a high risk factor, but there seems to be some genetic factor to that as well. I think they're a little more prone to seizures, so you want to be very careful with any chemicals that you put in these dogs or on these dogs, because they seem to be a little more prone to that. Obesity is a big one. We see a lot of fat Beagles.
Right. It's very common.
Yeah. Yeah. Well, there are certain dogs that are just like, I love food.
Right.
Beagles are one of them. I love food. I will get fat if you will give me half a chance.
Exactly. How about spaying and neutering?
Well, I grew up or came through the veterinary profession with the old, you just spay and neuter everybody at 6 months. That's how it was always done. Just like you vaccinate every year. That's how it was always done, until somebody looked at it and said, there might be a better way. Maybe we are not doing this the right way, because in Europe, they don't spay and neuter. In China, they don't spay and neuter. What are they doing, and what are we doing, and why are we doing it? So we could use the old, well, we're trying to keep pet overpopulation down, which in some areas of our country, that is a huge issue. But for my responsible pet owners, based on a study that came out a few years ago, one was in golden retrievers and one was in Rottweilers, because they have very large populations of spayed and neutered versus intact, because there's a lot of show dogs. Mm-hmm. They did studies looking at cancer rates and degenerative joint disease in those dogs, and they found that leaving them intact had definite protective effects as far as arthritis, degenerative joint disease, obesity, cancer. So they were huge studies. How well does that transfer over to small dogs? Don't really know. Have to believe that there is some validity across the species. And this is dogs only, because cats are not small dogs, and it's a totally different ballgame with them. So I really, for my responsible pet owners, the males, and for the first time in my life, I have an intact male in my house. Never thought I would do that. But I know better now. It's one of those things, when you know better, you do better. Mm-hmm. So for the males, I pretty much am saying, look, if he's not having behavior issues, if you're not having problems with him, why not leave him intact? For the females, there's a balancing line somewhere in there, and we don't know where that is. Those who are left intact throughout their life are definitely more prone to develop mammary cancers, and the mammary cancers have about a 50% chance of being malignant. The other problem with females is pyometra, which is an infection in the uterus, which then you've got a sick dog that needs an emergency spay, because it's generally not treatable with just throwing antibiotics at them. So for right now, and we know that we don't want to spay until all growth plates are closed. So depending on the size of the dog, again, that's a sliding scale. Mm-hmm. But I would say the majority of my responsible holistic pet parents were spaying the females around 2. Mm-hmm. So they're going through a couple of heat cycles. And we have to, and some people are doing ovary sparing spay, where we leave the ovary, but we spay them, so that at least we don't have to worry about the pyo and the dog getting really sick with that. We still might have to deal with some mammary issues later in life. So that has changed over the years, as far as our outlook, but so has, the vaccine debate and the food debate and so many other things. With the food debate, I feel like we've just come full circle. We've gone back to, hey, what did dogs eat when they were on the farm back in the 1950s? Oh yeah, that would be all the food that was left over from the people.
Exactly, yes. And the lifestyle then was different too. They were not spaying and neutering, I'm guessing, in those times either.
Right.
And they were eating whatever scrap was there, whatever.
And we didn't have all these vaccines, and we didn't have all these chemicals.
Exactly, yeah. So, yeah, it's fascinating.
We're coming back around.
Exactly. Yes. That's as you said. The food and diet is very important. It affects all. It's what goes in and makes everything happen.
Yep, exactly.
Thank you very much. I think I asked all my questions. And is there any last word that you would like to share with everybody?
Well, like I said, or you said, I'm trying to change the lives of 10 million pets through education and outreach. So I would ask that people go to my website, drjudymorgan.com, drjudymorgan.com, and you'll find lots of information there. Share it with your friends. My Facebook page, Judy Morgan DVM, if you're on Facebook. We do Facebook Live Monday through Friday, generally around 8:30 a.m. Eastern Time. So that may not work for you guys. You have to watch it later in the day. But it's informative, and it's basically free information. I talk about different diseases, whatever people are asking me to talk about. I just want people to get information. And that's why I only have 2 books up here, but we've actually written 4. And it's just to share information, make you an informed pet owner, so that when you go to the veterinarian or you have to go to boarding, grooming, daycare, whatever, you are well informed. And I give alternative treatments in the books as well as traditional, so that you know what the different offerings are, how certain diseases might be diagnosed, what tests to ask for. So it can be very educational for you, so that you can just become a better pet owner.
Exactly. Yes. I think it takes one person at a time to make a difference. And for example, myself, I have a doggy daycare and training, and I'm also focused on not asking dog owners, vaccinations and this and that, because I know the benefits of titer testing and not vaccinating. Yep. And I go, vaccination free zone here. You don't have to
That's awesome.
about those stuff, because, and I'm also advocate for better health for dog owners with diet and, all the good stuff that we learned today. Thank you very much. I really appreciate that. And as you mentioned, the best way to get in touch with you and learn about you is drjudymorgan.com.
Yep.
I'll leave all the information in the description. Once again, thank you very much. Appreciate it.
Thank you.